Aloha, this is Patrick, Recovery Conversations. Thanks for being here. I wanted to share some feedback I got on one of the videos I posted. It was about smart recovery. And the feedback I got was about a girl, barely 21, who watched it and had made the assumption that SMART was a lot like AA, and she decided not to pursue any kind of support. And she admitted to her mom after watching the video that she's got a problem with alcohol, and that knowledge, knowing that there's other options, opened the door for her to be honest about it and say, I need some help. And that conversation reminded me of a chat I had with Dave Tieff, and I wanted to share that with you. In this conversation, Dave is talking about the importance of seeking out professional help. You know, when you give up alcohol or drugs and go from that right into a support group, there's a good chance you're skipping over a critical part, which is treatment. And there's a big difference between treatment and support. And unfortunately, the way our society works is that the general advice is, you know, stop drinking and go to 12-step meetings, go to AA. And this just drove home the point that being exposed to other options can be critical, if not life-saving, for a lot of people. So enjoy this clip, and I hope it gets you thinking about some alternatives and different ways to go about this. I appreciate your time, and thanks for being here. How do you open the door to recovery? You know, right now there's a narrative that says, somebody raises their hand and says, I'm in trouble. The answer is, have you heard of AA? Have you been to 12-step work? That's like, and where it comes from is that's how the entire industry is built. But is it effective is a different question. You know, like if somebody says, Dave, I'm in trouble. I think I'm overboard with alcohol. What would your advice to them be? How do you address the issue?
That's a great question, Patrick. And I can tell you honestly that many years ago, when people would come to me, now I cut my teeth in AA, so I've been to thousands of AA meetings.
Mm-hmm.
And there was a time when if anybody approached me about a drinking problem, I would have told them to go to AA. That's where I was. Um, I have to be honest again and say that I never experienced long-term sobriety within AA.
Mm-hmm.
And as I kept relapsing, I had to take an honest look at myself and say, what is not working here for me? Um, Today, if someone were to ask me, especially let's say it's someone who is really confessing like a problem, like instead of just like sober curious or something like that, where maybe they drink a little bit but they're thinking about just going dry January or whatever. If a person comes to me and has a genuine problem, the first thing I tell them to do, if at all possible, is to go talk to a qualified professional.
Yeah.
Because any alcohol, if you're on the spectrum of alcohol use disorder, you should be talking to a specialist that can then help determine how far along are you on the spectrum. Are you mild or moderate to severe with the problem, and then they can help you determine what to do. The good news is that most of the professionals that I've come across nowadays don't just funnel you right into AA. They're starting to give you more options like smart recovery, like, you know, if you're a woman, women's for sobriety. There's a couple others out there, SOS. There's an online community called TLC, which stands for the Luckiest Club, which is mostly women, but not all women. And so I think it's important to realize that a sober support group is just that support. The
Mm-hmm.
operative word is support and not
Mm-hmm.
the cure. And I think it benefits people to have that support group, but it's not necessarily the first place they should go if you're dealing with a potentially life-threatening condition and you're talking to a bunch of lay people who might have the best intentions in mind, but they may tell you that you're not praying hard enough or to go read the big book, which was written in 1939. And that might not be the best answer for your modern day medical problem.
Awesome. I'm on 100% on the same page with you on that. I think, I personally think you said it perfectly well, access to trained professionals. Um,
Now, and I
mhm.
understand like a big selling point of AA, and I get it, and I actually agree with it. It's free. Anybody can come, anybody can go, and it's free and it doesn't cost anything. And let's be honest, Patrick, a lot of us, when we're in the throes of alcohol addiction and we've gone through the ringer and we've got all kinds of problems, we're not usually clicking on all cylinders financially either. I
Yep.
mean, the two kind of go hand in hand. If you have a drinking problem, you're going to have some financial problems to go with it, right? So, but I guess my main thing is like, okay, I'm not saying that you need to get a high end specialist and see them every week, but go see a professional at least once or twice before you go to, if you want to go to a daily or weekly meeting, that's fine if that's what you guys determine together. But try to see a professional. You know, if you had something wrong with your pancreas or your liver or your heart or whatever, you need to go see a professional. Now, alcohol use disorder is a disorder of the brain. There's a chemical imbalance in the brain, and there may be medications that can assist you. There may be cognitive behavioral therapy that it can assist you. But to go from a severe drinking problem into a church basement where you're going to talk to a lot of lay people who will give you advice on the 12 steps, it's like I wouldn't go talk to them about a toothache. Why would I go talk to them about something wrong with my head?
Yeah, and I use an analogy a lot, which is that, when it comes to recovery programs, we're not bumping chests over whose favorite sports team is better. This is a life and death situation. If
Yes,
you're in a program where you can't be yourself and express your thoughts and feel supported, you're gambling with your life.
yes,
You got to take it that seriously, and that's why the options to me are so critical. Um,
100%. And I just want to reiterate something that you and I already discussed is that I'm not here, and I don't want to put words in your mouth, but we're not here to bash AA as a whole. I understand. In fact, I have family members in AA that swear by it, and it has helped them. The thing is, I feel like we need to get away from the narrative that it works for everybody. Because let's say, God forbid, I had a form of cancer, and so did one of my relatives, right? And they put us both on the same treatment, and the treatment works great for my relative, but it doesn't work
mhm.
for me. Now, should that relative be like, come on, you should be able to use that same treatment. It should work for you. If it doesn't work for me, I need to figure out what treatment does so that I can save my life as well. And we all know that not everybody reacts the same to different medicines, therapies. In fact, everybody reacts a little bit differently.